Nothing in this plan will require you or your employer to change the coverage of the doctor you have.
Our goal here is to cut spending and to protect the American people from Obamacare.
We need to repeal and replace Obamacare with a better system.
I want to be absolutely crystal clear. Any bill that defunds Obamacare is dead.
We will start by reducing premiums by as much as $2,500 per family.
This is playing with fire. Legislative arsonists are at work.
Obamacare is a law that's going to harm people.
We will never be able to balance the budget if you keep Obamacare going, because Obamacare is a fiscal train wreck.
If you like your plan, you can keep your plan.
You can't be held hostage. You can't have someone put a gun to your head and say, we're going to do horrible, ridiculous things unless you give in to us.
Obamacare is driving up the cost of health care. It's destroying millions of American jobs. It is a train wreck.
We are done.
And welcome to Hannity. Now, just a few hours ago, the House of Representatives stood up for the American people and voted to defund Obamacare. Tonight, for the entire hour, we'll be joined by a special studio audience from both sides of the aisle to debate the president's disastrous health care law. But first, here is how this all went down earlier today. In a 230 to 189 vote, the House passed a bill to fund the government through December the 15th, but not fund Obamacare. Now, before today's historic vote, both Republican and Democratic lawmakers took to the House floor to make their positions known. Let's take a look.
Today, we are considering a measure to fund government only if the Democratic Senate and Democratic President will agree to dismantle the health care reform law that will help millions of Americans access quality, affordable care. That isn't going to happen, and it is a blatant act of hostage-taking.
This resolution will also protect the working middle class from the devastating effects of Obamacare. Each week, we hear stories about how both major employers and small businesses are cutting back benefits and cutting back hours. The president's health care law is turning our full-time economy into a part-time economy.
What is brought to the floor today is without a doubt, a measure designed to shut down government. It could have no other intent.
I am getting frantic and heartbreaking calls from folks who've just received staggering increases in their health premiums, who've been notified their health plans being dropped or having their work hours cut back as a result of Obamacare. This stops that train wreck.
Now, this bill now heads to the U.S. Senate, where we can only hope that lawmakers have the same courage to stand up for what is truly in the best interest of their constituents. Now, Speaker Boehner had a message for Senator Harry Reid and his liberal allies.
We had a victory today for the American people. And frankly, we also had a victory for common sense. Our message to the United States Senate is real simple. The American people don't want the government shut down, and they don't want Obamacare. The House has listened to the American people. Now it's time for the United States Senate to listen to them as well. Thank you.
Now, we can only hope they do. And after today's smackdown on his health care law, well, President Obama, he just threw a temper tantrum.
They're not focused on you. They're focused on politics. They're focused on trying to mess with me. They're not focused on you.
All right, no one's trying to, quote, mess with you, Mr. President. They just want what is best for themselves, their families. Obamacare is not it. And now with reaction, we bring in our distinguished studio audience. All right, just for a sign of fair and balance, how many of you support Obamacare? Okay, 1, 2, 3, 4, 5. 6, I should have known. That was without saying. How many you oppose? 3, 4, 5, 6, 7. All right, stacked audience. All right, here we go. 8 if you include me. Here's the first question I have. Why is any of the president's promises, you carry this law with you, I don't know if you sleep with it, it's scary. Betsy, tell me, is the promises the president made, are they fulfilled in this bill?
Absolutely not. Chances are you won't be able to keep your doctor or your hospital that you prefer to use. Premiums are going up. On average, they're up 24% this year in the states that have already announced them. Many, many people are losing their full-time jobs. 77% of the new jobs created in the first 7 months of this year were part-time jobs. And hospitals are already laying off nurses because over half this law is paid for with cuts to Medicare. So the Cleveland Clinic, for example, announced today big layoffs. And when you lay off nurses, it means that patients wait longer for help, sometimes too long.
Let me go, Christy, I'm going to throw it back to you as a Democratic strategist here. Let me go through some of the numbers, though, for our audience at home. A report out today, 300 employees around the country have cut their hours. That includes 80 school districts, 46 universities, 239 public sectors have cut jobs because of Obamacare. Home Depot, 20,000 employees because of Obamacare. Cleveland Clinic, 5 to 6% of its workforce. Walgreens drops health coverage for 160,000 workers. Is this what Obama promised? You can keep your care?
Right, Sean. So these are sort of like Republican media fairy tales, because when we dig a little bit deeper, it turns out that they're all a little bit fictional. Let's take the Cleveland Clinic, for example. Yes, that story came out today, but when you actually talk to the communications director for the Cleveland Clinic, what she said was...
So you called the communications director for
the PR person,
the PR wing of the Cleveland Clinic. Okay.
Sure. What she actually said was, look, all of these things that happened are things that would have happened anyway. It was not about Obamacare. Yes, we're trying to cut
Depot,
costs.
20,000 jobs.
Every good.
What about Walgreens
Yes.
dropping health coverage for 160,000? Did you talk to their PR agent?
I am in
communication with them. She's going to spin it that way and tell you that this was already planned, but it wasn't planned. This is exactly because of Obamacare. People are scared of it, and they know that these regulations.
To lie about
that. Well, let me give you
Can we just make one point?
Sure.
And let's use the president's own words on Telemundo, because you can spin all you want, but costs are going up. And the president said on Telemundo 2 days ago, this has been the lowest increase in years. Guess what? That's still an increase. It just means it didn't go up as much.
Well, wait a minute.
So costs are increasing.
The average family, we just played it. The average family was going to save $2,500 a year. Does everyone agree?
So is the president lying on Telemundo? Let's call it what it is.
Sean, the IRS,
his words.
The IRS, which obviously we know is very connected to the president, says it's not true. They say by 2016, premiums are going to go up for the average family of four by $4,000. So the problem with the Obamacare, we're realizing now, and that's why the American people are so fundamentally opposed to it, is it's not establishing any of the, or meeting any of the objectives that it set out. When you look at the GAO, another government office, they're saying by 10 years actually, that more people are going to be off healthcare, not have healthcare coverage, than there are today as a percentage of population. Isn't Obamacare about expanding access and expanding coverage?
Wait, Robert, wait, this is important. You're a Democrat. The president made promises. We'd save $2,500 a year per family. You get to keep your plan. All of these companies are saying you can't keep your plan, and number two, nobody's saving any money. So why not then delay it and get it right so those promises would be fulfilled?
Your statistics are not true.
Which
People
one?
watching television want to go
They're
to
the government statistics.
Want to go
so blame
to
them.
Rand Corporation, Kaiser Family Foundation, and study the premium prices the last 2 years, and the average American premiums are going down. Controlling costs, which we all agree is essential to Obamacare.
The president on Telemundo says it's the lowest increase. You're saying they're going down. Are you telling me
And
you're
by the
right,
way,
the president's
what's
wrong?
Your plan? You cannot beat something with nothing.
No, I asked the question. Are you right? Is the president wrong?
The Republicans have announced the plan this week.
It's not a plan. It's just defunding.
No, that's not true. Let me educate you. Because the Republican plan is $20,000, a tax break for families, $7,500 per individuals, and it goes into greater detail than that. I had a doctor who's a congressman from Tennessee on my radio program today, went into great specificity about it. So they do have a plan. They do have a replacement plan that would allow for portability. If you lose your job, you could keep your coverage at the new job you go to.
It also covers far fewer, millions of people fewer than the Obamacare plan. So I just don't understand how it's achieving the objective.
Let me point something out. Let me give you a quick fact about cost. Today, the Congressional Budget Office came out with their 10-year long-term plan, and you can see hidden in that Federal health care costs are going to increase by 53% or more because of Medicaid expansion and because of subsidized exchanges. And hospitals like the Cleveland Clinic made a deal with the devil to slash Medicaid funding in order to increase, Medicare funding in order to increase Medicaid funding. This was all a done deal. It's all about the bottom line.
I want to talk about the Cleveland Clinic a little more because it isn't about talking points. The CEO of the Cleveland Clinic is a cardiovascular surgeon who said in 2009, after President Obama visited there, this is a problem. We want to give people more insurance, but this cost is too high. The Cleveland Clinic runs on a very narrow margin, and that's why they're getting rid of employees right now. That's why they're getting rid of health coverage right now, because they can't afford it. They rely on charity. They can't afford Medicaid and Medicare even before Obamacare.
Emma's making a face at you. So.
Well, because we debated this earlier, and here's the biggest problem. The problem is that Boehner is a criminal. He should be investigated for extortion.
What crime?
Because what he is doing, extortion. What he is doing is he has created. Well,
how is this extortion?
Sure, I will explain if you stop snickering in the back. The issue is that we can debate the health care issue and Obamacare, Affordable Care Act, whatever you want to call it, all day long, which is what this debate has seemed to become. What it is about is shutting the government down, the first shutdown in the history of our. That is the problem.
You're a lawyer. Have you read the Constitution?
Yes, many times.
Who has the power of the purse?
The House, and James Madison said in Federalist 58, whenever the president reaches for more power than the Constitution allows him to have, it is the duty of Congress to deny the funding.
The issue is that Boehner is threatening to shut the government down.
Yes, he is, and you know why? It's our duty to do that because our president has violated.
I agree with you. I agree with you.
Yes,
we're going to get to the incendiary rhetoric. We're also going to get to exactly what you're talking about. And coming up also, two lawmakers who stood up for their constituents and voted earlier today to defund Obamacare. They're going to join me next from D.C. And then later, our very spirited studio audience reacts to the left's incendiary rhetoric. We're going to play it for you tonight. And that's Pelosi, and that's Reid, and that's Obama himself. And we'll get full reaction as we continue.